This shirt will be worn today at work for Pinktober. We were given this shirt yesterday. Hi everyone, this is shocking for me. For the first time in my life after 48 years, I learned that yes, men do develop breast cancer. We were privileged that my company, Comrade Trustee Services Limited, invited Badley Medical Center to come and speak with our staff. And the session was both insightful and eye-opening. While recording, I accidentally switched cameras between the front and rear camera and degraded the audio quality for about 10 seconds. Right when Dr. Baki mentioned that 99% of breast cancer cases are women and 1% are men. 1% of breast cancer cases around the world, possibly including here in PNG, are men. Curious, I verified through a CNN news article of October 2024, which confirmed the statistic. Watch till the end as Dr. Baki shares a case of a male breast cancer patient treated here in PNG. One of the few reported, as many cases go undiagnosed or are untreated. Sadly, that patient passed away 7 years ago.
Who is at risk? 99% of women versus 1%. So men are not safe from this, but it's very rare. And in my surgical career, I'm a male individual with breast cancer, so it does happen, right? There are risk factors involved. So majority is women. However, they're multifactorial. More than one factor has to be present within the same patient or person in order for them to develop it. So it doesn't mean that 99% of women, we expect them to have breast cancer. There's always associated risk that will then enable the progression for that swelling to become cancerous. We have another associated cancer, all right? And if you're taking a lot of alcohol, and if you have family history in your family, with your paternal or maternal side, but usually we see in the maternal, your mother's side, that will lead to the progression of breast cancer. So if you have a positive family history from your mother's side, then most likely you are at risk. And then they look at eating too much, a sedentary type of lifestyle. So that means it also is associated with people in office jobs. You sit down for more than 8 hours of the day, you eat too much, you don't exercise. Those are all risk factors. Doesn't mean that you will have it, but these are just part of the risks that are involved in developing breast cancer. All right. There are other newer risks that have been identified, but it's not as...
So you mentioned something about that one male who developed breast cancer. Was that here in PNG or somewhere overseas?
It was here in PNG. It was one of my patients. I could give you a bit more, elaborate about this history, to give you just an insight on how. So that individual presented to the hospital after innocent swelling on the breast. In males, it's quite different. They don't present like with women. Because with men, we tend to wait it off a bit longer than women do. However, I've noticed that in this day and age, women tend to present early because of the awareness now about breast cancer. And this is for women within the city. Unfortunately, women outside, no, it's not the case. It's very difficult. Now, this individual presented to us because of the mass that was present for more than 6 months. When he presented to us, it already had indurated, meaning that it changed the skin on the inside of the breast. So it confirmed that he had cancer. All right. Similar process as we do with females, with female patients, is that we have to confirm the diagnosis and make sure that the mass or the cancer hasn't spread. So we call that metastatic screening. And usually in women, when they go for screening purposes, the steps are like this. Women presents to the hospital with a mass. We suspect that it's a cancerous lesion. The next step to do is we have to confirm. There are 3 ways to do it. One is with what we call an FNAC or biopsy. Fine needle aspirate is just with a little needle, we aspirate part of the cells out, look under the microscope to confirm that cancer cells are present. After that diagnosis is made, it's either 2 ways that you can decide. Whether we send them off straight to chemotherapy, based upon the new treatment protocols that we do have in the country, and they go through a certain number of cycles before we decide to remove the breast. That is the current trend. And that's only if you catch it early. I will state this, that breast cancer is completely curable if you catch it early in the early stages. And you're looking at stage 1, stage 2. Once you go stage 3 and stage 4, the management becomes a bit complicated and tedious. Once you hit stage 4, we often talk about palliative care. It is manageable, but it's not curable. Okay, and that's one thing to take note. If you identify it early, you can go into remission, meaning cancer-free, once we determine the treatment and once we remove the pathology. So this individual, unfortunately, passed away. And this was about 7 years ago. All right, so I do not know how common it is, but it is common. Like I said, only 1% of males do present with it. However, this individual had a background history of family of cancer. Okay, so that's the other thing. And he was a chronic smoker and an alcoholic for a number of years before he presented. So these are the additional risk factors that involved for him to develop this. So he had three risk factors, and he had a more likely chance of developing breast cancer. Any other questions?